We're here at Lake Charles Memorial Hospital. Today we're talking to Ray Gardner, a nurse here in the oncology department. And today we're talking about that first moment when a woman hears that she has breast cancer. It can cause a lot of anxiety, a lot of fear, but that's why you're here.
That's why we are here. We have some tests that we can do for these ladies now that are undergoing breast cancer therapies, maybe starting with surgery, and they have a lot of fear and anxiety. Those words, "you have cancer," are certainly quite a stress to them, not only to them, to their families, and also trying to decide what treatments they're going to need related to that breast cancer.
And that's where genomic testing comes in, and I think a lot of us may have heard the term, but we don't really know what it is. So what is genomic testing?
Genomic testing are tests that they do on breast cancers that are surgically removed. They take that tissue and they test the genes and the activity level of those genes in that breast tumor, and that helps them to decide whether or not further treatment might be necessary for their breast cancer.
And is that something that the doctor does just as a matter of course? Is it something that you have to ask for, or does it depend upon your individual case?
It's individualized to the patient depending on the type of cancer and how early stage the breast cancer is. Most of the breast cancer genomic testing that we do are done on stage 1 and stage 2 breast cancers, which are early stage. And it also depends on the size of the tumor as well as if it has spread to other areas. And it can also depend on the hormone status of those tumors, so whether or not it's estrogen receptor positive or negative.
So would you recommend genomic testing for everyone, or do you need to talk to your doctor?
I would say talk to your doctor. Most physicians are going to recommend it depending on your age and the status of your cancer, at diagnosis. So once they have that surgical resection, we'll be able to make a better decision if it's going to be beneficial to you.
All right, so what do you look for in that genomic test, and how does it affect what you do from that point on?
The two main types of genomic tests that we do on breast cancers are MammaPrint and Oncotype DX. The MammaPrint test looks at 70 different genes in the breast cancer tumor and determines how active those genes are and what the risk of recurrence is. It may be a low risk or a high risk, and so depending on what the result of that genomic test is, will help us to determine whether or not further treatment might be necessary, like chemotherapy after surgery.
So it really helps you tailor what you're going to do for that individual patient.
Certainly it does. The Oncotype DX gives us a little different score. Its scoring system is a breast recurrence score that's scored from 0 to 100. And depending on how low or how high that score is, helps us to determine that risk of recurrence later, and also, again, how beneficial chemotherapy might be to that patient.
All right, it's really interesting the advances that have been made in fighting breast cancer, and if you'd like to find out more about genomic testing, you can give them a call here at Lake Charles Memorial Hospital in the Oncology Center, and they'd be happy to answer your questions. Thanks for talking to us today.
Thank you.